Good, happy Friday morning, August 6th, 2021. I'm Riley King, and welcome to this Friday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin right now. First up, River Dave released from jail day after cabin at center of legal battle burns down. Let's take a listen to that video from WMUR News 9.
When it's time to invest in a new roof, be smart and look at more factors than just the final price. Not all roofs are the same, and not all roofers are the same.
After 3 weeks behind bars, David Lidstone, known as River Dave, is once again free. Jody Gideon, a friend and supporter, picked him up from the Merrimack County Jail.
It was overwhelming with joy. It was, I don't even know if I can put it into words. I was just so happy to see him. So happy. I really was.
Lidstone's release comes a day after his Canterbury cabin on the Merrimack River burned down, hours after a hearing in a battle over that cabin. Lidstone told the judge he would rather stay in jail than comply with a court order not to return to the property because someone else owns it. A day later, the judge said now that Lidstone's cabin is gone, he has less incentive to return and can only go to gather any remaining belongings.
It was heartbreaking. It was heartbreaking.
Lidstone's case has gained national attention, and Granite Staters like Gideon are rallying around him. On his first night out of jail, she says Lidstone is safe and staying with a friend, and they're ready to help with whatever comes next.
Now that Dave's out, we can talk to him, figure out the next plan, and just see what to do. And it's not just monetary. People have reached out offering their cabins, their land for Dave to live on.
Well, the state fire marshal's office is investigating how that fire started, and an in-person status hearing in Lidstone's case is set for next Wednesday.
okay, there you go on that video and that report. Clinics seeing sharp uptick in demand for COVID-19 testing in New Hampshire. Let's take a listen to that video from WMUR News 9. Okay, sorry about that. We do not have a video for you there. As COVID-19 cases rise in New Hampshire, the demand for testing is too. And providers are seeing a swift uptick, prompting one hospital to take action. With more than 24 clinics across New Hampshire, Massachusetts, and Maine, Convenient MD was averaging about 300 COVID-19 tests a day just 2 weeks ago. Now that number has jumped to more than 550 a day. It's like a do-over of last year all over again. I have a lot of providers and staff members that are anxious just thinking about the volume coming back again, said Sarah Leslie, physician assistant at Convenient MD. Despite that, Convenient MD said it's ready to handle this sudden increase in demand. We are seeing those that are coming in that have had exposure through travel or positive family member as well, Leslie said. Memorial Hospital in North Conway will reopen its COVID-19 testing center on Monday. It's been closed since July 5th but now officials said more people are looking for a test, and students will too when they go back to school. We hope that this wouldn't come into play as far as having the Delta variant becoming much more real than we hope, but it is, said Arthur, president of Memorial Hospital. The hospital's testing center will be by appointment Monday through Friday. Currently, no one there is admitted with the virus, but overall, they are seeing a slick uptick in people seeking treatment for COVID-19. Now, we're going to have to manage COVID-19 patients as well as non-COVID-19 patients and continue both of those missions probably for a significant amount of time, Arthur said. Memorial Hospital, Convenient MD, and all providers said they will be there for their communities. They encourage everyone who hasn't already to get the vaccine. New Hampshire school districts announced flexible back-to-school plans. Let's take a listen to that video from WMUR News 9.
My old roof was an asphalt roof. It was really starting to look ragged. It's an island house. I wanted it to blend in better. So
Manchester's back-to-school plan is not finalized yet, but right now the school district wants all students in class, saying that in-person instruction is crucial to helping students recover from both the learning and social-emotional impact of this pandemic. Manchester plans to implement safety measures like masks, distancing, and outdoor activities, along with Wellness on Wheels events this month, offering fun activities along with vaccines. Bedford says for now masks continue to be recommended but not required in schools, saying as the school year begins we will be watching community transmission rates very closely and monitoring clusters and outbreaks in our schools. Concord schools will require masks inside regardless of vaccination status until the city reaches a full vaccination rate of 70% or vaccines are available to elementary school children.
Those decisions will be made in terms of what's the best route for our students in ensuring safety.
Using federal funds, Concord hired a nurse to give rapid COVID tests to staff or students not feeling well with parental permission.
And all of this is fluid. Next week, schools will be hearing recommendations from the State Department of Health and Human Services that could alter their return to school plans. Live in Manchester, where you might be hearing the fireworks from the Fisher Cats game, I'm Jean Mack, and back to you.
Okay, and there you go on that video and that report. More than 200 new COVID-19 cases reported as New Hampshire sees substantial spread of the virus. Let's take a listen to that video from WMUR News 9.
I think what sets us apart is the fact that our technicians live and breathe only chimneys. It's not a part of our company, it is our company. We do everything from sweeping the chimney, maintaining the chimney, repairing the chimney, rebuilding the chimney. Our inspections are top to bottom, inside and out. We make sure that the entire chimney as a whole has been inspected and can function as a system rather than just a fireplace. The biggest value that customers get from having us in their home is
we're now actually on the CDC map classified as having a substantial level of community transmission. This is the wrong direction for our country in terms of the COVID-19 pandemic.
New Hampshire State epidemiologist Dr. Benjamin Chan today telling people involved in healthcare the COVID-19 Delta variant is causing community transmission to spread across the country and in New Hampshire.
Nationally, around 83% of specimens are being identified as the Delta variant.
Dr. Chan says over the last 2 weeks, 45% of COVID-19 specimens collected here in New Hampshire were the Delta variant. In the last week, the number jumped to 65%.
We are similarly seeing increasing transmission due to the Delta variant.
But Dr. Chan says the COVID-19 vaccines are working against the variant.
In general, preliminary estimates show that the Pfizer COVID-19 vaccine is probably around 80, maybe 85% effective at preventing infection from the Delta variant. But it's much higher at preventing severe disease, including hospitalizations and deaths from COVID-19.
Even still, he says the continued spread of COVID-19 will keep the state from getting out of pandemic mode.
We believe that anybody who becomes infected has the potential to spread it to others in the community, and so the pandemic goes on.
And Dr. Chan continues to support mitigation measures such as wearing a mask in public settings indoors. He says that will help protect those who can't yet get vaccinated. In studio, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. Hinsdale man shot, killed 12-year-old son before killing himself, investigators say. Let's take a listen to that video from WMUR News 9.
Come see Darla and Hildy at Clark's Bears in Lincoln, New Hampshire. Visit clarksbears.com to reserve your tickets today.
Breaking update now to a story we've been following out of Hinsdale. The Attorney General's office says a 47-year-old man shot and killed his son in his Plain Road home before turning the gun on himself. Autopsy results show David Lent had a single gunshot wound. 12-year-old Tyler Gilbert had multiple wounds. Responding officers say a pistol was found next to the father, and someone at the home witnessed the incident. The son lived in Vermont and was in town to visit his dad and grandparents.
Okay, and there you go on that video and that report. Moderna plans to seek full approval for COVID-19 vaccine. Let's take a listen to that video from WMUR News 9.
Come see Darla and Hildy at Clark's Bears in Lincoln, New Hampshire. Visit clarksbears.com to reserve your tickets today.
As cases of the COVID-19 Delta variant rise across the country, Moderna is now recommending a booster shot for its 2-dose vaccine.
We do know that the vaccine has efficacy and protection against Delta variant right after you receive it. But knowing whether or not that will hold up, for instance, through the winter is not something we have information on right now.
Company president Stephen Hogue says a small study showed that a half dose of the original vaccine, given 6 to 8 months after the second shot, increases antibody levels high enough to fight variants.
The decision of whether to deploy a booster really is for public health officials, not us as a company, and what we're going to do is prepare options.
Lonza Biologics in Portsmouth is a key contributor in the production of the Moderna vaccine. Dartmouth Hitchcock epidemiologist Dr. Jose Mercado says 2 main questions still exist. How long does the immunity of the vaccine last, and how effective is it against mutating variants?
Traditionally, based on what we know on how vaccines work, is that eventually the immunity wanes.
Dr. Mercado says boosters for all forms of COVID-19 vaccines could be necessary long-term until the majority of the population is vaccinated.
So I think the first step really is to achieve herd immunity, vaccinate those unvaccinated individuals so that we could decrease the chances of seeing more variants that are problematic.
Now, Moderna President Stephen Hogue also says they're hoping any day now to receive FDA approval on vaccines for children ages 12 to 17 and hoping by the end of the year for children under 12. Reporting live, Jason King, WMUR News.
Okay, and there you go on that video and that report. And that does it for this edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your Friday and have a wonderful weekend. And I'll see you back here on Monday for another broadcast. I'll be off air this weekend. Thank you for joining us for this Friday morning edition of the Riley King Newscast, right here on the Riley King Network. Goodbye, everyone.